Hello, I am Dr. DeAndre. Today I will talk about the top 5 skin mistakes that damage your face daily. A large number of individuals follow skincare routines consistently, but still struggle with dullness, acne, uneven tone, and early signs of aging. The issue is often not the lack of products, but incorrect daily habits that silently damage the skin over time. Scientific evidence confirms that repeated minor damage to the skin barrier can accumulate, leading to chronic inflammation, increased sensitivity, and visible aging. Many of these mistakes are common, preventable, and often overlooked. Your skin acts as a protective barrier against environmental stress, bacteria, and harmful radiation. When this barrier is disrupted repeatedly, it loses its ability to retain moisture and defend itself effectively. This results in dryness, irritation, breakouts, and pigmentation. In this video, I will explain 5 of the most common mistakes people make every day, how they affect the skin on a physiological level, and what evidence-based steps you should take to avoid them. Understanding these factors will help you improve your skin health using simple, medically correct practices rather than relying only on products. Over-cleansing is one of the most frequent and underestimated causes of skin damage. The outermost layer of your skin, known as the stratum corneum, contains natural lipids and proteins that form a protective barrier. This barrier plays a critical role in maintaining hydration and preventing harmful substances from penetrating deeper into the skin. When you wash your face excessively, especially more than 2 or 3 times per day, you begin to strip away these essential lipids. Clinical research shows that excessive cleansing increases transepidermal water loss, which means your skin loses moisture more rapidly. This leads to dryness, tightness, and irritation. In response to this dryness, the skin may produce more oil as a compensatory mechanism. This is particularly important for individuals with oily or acne-prone skin. Many patients believe that frequent washing will reduce oiliness, but in reality, it can worsen sebum production and lead to clogged pores and increased acne formation. Another important factor is the type of cleanser used. Harsh cleansers containing alcohol, strong detergents, or sulfates can disrupt the natural pH of the skin. Healthy skin maintains a slightly acidic pH of around 5.5, which supports beneficial bacteria and protects against harmful microorganisms. When this balance is disturbed, it creates an environment where irritation and infection are more likely to occur. Patients who overcleanse often report symptoms such as redness, flaking, burning sensation, and increased sensitivity to skincare products. Over time, this repeated damage weakens the skin barrier, making it more vulnerable to environmental stressors such as pollution and UV radiation. The medically recommended approach is to cleanse your face twice daily, once in the morning and once at night, using a gentle pH-balanced cleanser. Lukewarm water should be used instead of hot water, as high temperatures can further strip natural oils. This simple adjustment helps preserve the skin barrier and maintain overall skin health. Skipping sunscreen is one of the most harmful daily habits affecting skin health. Ultraviolet radiation from the sun is scientifically proven to be the leading cause of premature skin aging, accounting for up to 80 to 90% of visible changes, such as wrinkles, fine lines, and pigmentation. This process is known as photoaging. UV radiation penetrates the skin and damages collagen and elastin fibers, which are responsible for maintaining skin structure and elasticity. There are 2 primary types of ultraviolet rays that affect the skin: UVA and UVB. UVA rays penetrate deeper into the dermis and are primarily responsible for aging and long-term damage. UVB rays affect the outer layers of the skin and are responsible for sunburn. Both types contribute to DNA damage in skin cells, increasing the risk of skin cancer over time. A common misconception is that sunscreen is only necessary on sunny days or during outdoor activities. However, studies show that up to 80% of UV rays can penetrate clouds, meaning your skin is exposed even on cloudy days. In addition, UVA rays can pass through glass, which means indoor exposure near windows can still contribute to skin damage and pigmentation. Clinical studies have demonstrated that individuals who use sunscreen daily show significantly fewer signs of aging compared to those who do not. One long-term study found a reduction of up to 24% in visible skin aging among consistent sunscreen users. The recommended practice is to apply a broad-spectrum sunscreen with at least SPF 30 every morning, regardless of weather conditions. It should be applied as the final step in your skincare routine and reapplied every 2 to 3 hours if you are exposed to sunlight for extended periods. Neglecting sunscreen not only accelerates aging but also reduces the effectiveness of other skincare treatments. Consistent use is one of the most effective preventive measures in dermatology. Active ingredients such as retinoids, alpha-hydroxy acids, and beta-hydroxy acids are widely used for treating acne, pigmentation, and signs of aging. While these ingredients are effective, their misuse is a common cause of skin damage. These compounds work by accelerating cell turnover, which helps remove dead skin cells and stimulate collagen production. However, excessive use can overwhelm the skin and compromise its protective barrier. Retinoids, for example, are known to improve skin texture and reduce fine lines. However, when used too frequently or in high concentrations, they can cause irritation, redness, peeling, and increased sensitivity. Similarly, chemical exfoliants like glycolic acid and salicylic acid can damage the outer layer of the skin if overused, leading to inflammation and micro-injury. Clinical evidence indicates that overexfoliation weakens the skin barrier and increases susceptibility to environmental damage. Patients often combine multiple active ingredients without understanding their interactions, which significantly increases the risk of irritation. This is particularly problematic when strong exfoliants and retinoids are used together without proper guidance. Symptoms of overuse include burning sensation, dryness, excessive peeling, and increased breakouts. In some cases, it can worsen underlying skin conditions such as rosacea or eczema. The correct approach is to introduce active ingredients gradually. It is recommended to start with application 2 to 3 times per week and monitor the skin's response. Moisturizers should be used alongside active treatments to support barrier function. Additionally, sunscreen is essential because these ingredients increase sensitivity to UV radiation. Using active ingredients correctly can provide significant benefits, but misuse can reverse progress and lead to long-term damage. Controlled and informed use is critical for maintaining healthy skin. Moisturizing is a fundamental step in maintaining healthy skin, yet it is often neglected or done incorrectly. The skin requires adequate hydration to maintain its barrier function and protect against external irritants. When the skin lacks moisture, it becomes dry, tight, and more prone to irritation and inflammation. One common misconception is that individuals with oily or acne-prone skin do not need moisturizers. In reality, all skin types require hydration. When the skin becomes dehydrated, it may produce excess oil to compensate, which can lead to clogged pores and acne formation. This creates a cycle where a lack of moisture leads to increased oil production and worsening skin conditions. Moisturizers contain ingredients such as ceramides, hyaluronic acid, and glycerin, which help restore and maintain hydration. Ceramides are essential for repairing the skin barrier, while humectants like hyaluronic acid attract water to the skin. Without these components, the skin cannot effectively retain moisture. Clinical studies show that a compromised skin barrier is associated with increased sensitivity, redness, and conditions such as eczema and dermatitis. Patients who do not moisturize regularly often report persistent dryness and discomfort. It is also important to choose the correct type of moisturizer based on your skin type. Lightweight, non-comedogenic formulas are suitable for oily skin, while thicker creams may be beneficial for dry skin. Application should be done immediately after cleansing to lock in moisture. Proper moisturizing not only improves skin texture but also enhances the effectiveness of other skincare products. It is a simple but essential step in maintaining long-term skin health. Touching and picking the face is a common habit that significantly contributes to skin damage. The hands come into contact with various surfaces throughout the day, accumulating bacteria, oil, and dirt. When you touch your face, these contaminants are transferred to the skin, increasing the risk of clogged pores and infection. Acne lesions are particularly vulnerable to damage from picking or squeezing. This action increases inflammation and can push bacteria deeper into the skin, worsening the condition. It also delays the natural healing process and increases the likelihood of scarring and post-inflammatory hyperpigmentation. Scientific data indicates that repeated trauma to the skin significantly increases the risk of permanent marks, especially in individuals with darker skin tones. Even minor picking can disrupt the skin structure and lead to uneven texture over time. Patients who frequently touch their face often experience persistent acne that does not respond well to treatment. This is because the underlying cause, which is repeated contamination and irritation, is not addressed. The recommended approach is to avoid unnecessary contact with the face. Hands should be washed regularly, and conscious effort should be made to reduce face-touching habits. Acne should be managed using appropriate medical treatments rather than manual extraction. In cases where extraction is necessary, it should be performed by trained professionals under sterile conditions. This reduces the risk of infection and scarring. Avoiding this simple habit can significantly improve skin clarity and reduce long-term damage. In summary, daily habits such as over-cleansing, skipping sunscreen, overusing active ingredients, not moisturizing properly, and touching your face can significantly damage your skin over time. These actions weaken the skin barrier, increase inflammation, and accelerate aging. Improving your skin health requires consistent, evidence-based practices rather than excessive product use. Small corrections in daily routine can lead to noticeable long-term improvements. If you are experiencing ongoing skin concerns, consult a qualified medical professional before making changes to your routine. If you found this information helpful, consider sharing this video and subscribing for more medically accurate content.